Hi, Dr. Dominic here at Elite Facial Plastic Surgery. I know many patients have wondered and looked into what is involved with a rhinoplasty once the procedure is done. It's what we call the post-operative course. And for the most part, I would say that the post-operative course after, what we call primary rhinoplasty, nobody's had surgery before in their nose, should be fairly consistent. And for my patients, you can plan on having a splint on the nose after the procedure, anywhere from 5 to 7 days, depending upon when you do the procedure. Now, after you have the procedure done, you may or may not have some dressing in the nose. It can be sometimes called packing. I'm going to have a separate video on that, talk about it. But in many instances, you don't need packing in the nose if you've had nothing done inside the nose. So that's one thing that I want to drive home is if you have a rhinoplasty, you don't have to have the dreaded packing. Now, after your rhinoplasty, you're going to go home, and I often recommend patients put some crushed ice in a Ziploc bag, one over each eye, and do that for about 20 to 30 minutes on, 20 to 30 minutes off for the first 4 hours after the procedure. In addition, you can also take either the pain medication your physician prescribed you, or you can take Motrin. I would say 90 to 95% of my patients normally are taking the Motrin route. Rhinoplasty should not be severe pain. Now, everybody has a different pain threshold, but for the most part, it's more soreness. That's where the ice really helps out with the swelling and the soreness. After that first day, the next day, you're going to feel a little bit sore. You're going to be stuffy and congested. And then every day thereafter should get a little better. I usually recommend patients to put a little bit of peroxide and then dab it clean where the incision is. Inside the nose, you normally don't have to mess with that and just leave it alone. You will also probably have a little drip pad underneath your nose that you'll go home with. And normally after about 24 hours, you won't need that. When you return back to the office, let's say on post-operative day 5, we'll take your splint off. And that process is done very gently. When we do it, we put a little bit of alcohol to loosen up the adhesive, and then the cast comes off. We also take out, there's 5 small sutures that are underneath the nose here, and those come out as well. The rest of the sutures in the nose, again, in my practice, are absorbable and don't need to be removed. In that point in time, moving forward, the swelling will continue to go down. And if you do any reading on rhinoplasty, you'll see that rhinoplasty, you need to give your nose about a good 9 to 12 months to fully settle. And normally that healing process and swelling process starts from the very top, and then the last place to settle out is the tip of the nose. And the reason why is that part of the nose has a large amount of cartilage and soft tissue. That's also the location where the incision is. So it takes time for the body to get rid of that fluid. Now, the bruising part is something patients are often inquiring about. If patients have any bruising, that usually resolves after about 14 days. Sometimes you can have a little residual bruising that will persist here a little bit longer, but for the most part, the majority of the bruising goes away after about 14 days. At that point in time, I usually tell most patients you can get back to your normal routine. Obviously, I don't want you doing something like kickboxing or any kind of sparring, because if you're going to spend time laying your nose, just stop doing that stuff. Otherwise, the recovery process is not bad. It's more soreness. I hope this shed some light on the whole recovery. Please check out our YouTube channel, because I posted the videos regarding rhinoplasty as well as other topical facial plastic surgery, and we're always available for any questions. Have a great week.